Hey, everybody. I just wanted to hop on live and go over screening tools because this is a question that I get a lot in my practice as well as just in general when, we're talking about pediatric mental health and behavioral issues. One of the things that you should know about screening tools is yes, it's a piece of paper, or in my case, in my practice, I do it electronically. But it's really important information. Screening tools is just that. It's a way for physicians or other providers, like psychologists, to get information quickly and in a standardized way. So it's a way of asking a question that has been looked at across lots of different populations and validated to be asked in a certain way. So, for instance, in my practice, when I see patients for the first time, I see kids with behavioral and mental health issues. There is no blood test, there's no imaging study, and there's no throat swab that I can do to say, hey, it's ADHD, hey, it's anxiety, or oh, it looks like depression. That's not how behavioral health problems work. Unlike, a pneumonia or an ear infection, where we can actually look and do a physical exam and diagnose a problem, in behavioral mental health conditions, that's just not how we do it. Instead, we need to take a really good history, and oftentimes we'll ask parents, teachers, and the patient themselves to give us some information, some data on how things are going at home and school. For me, that's why I created my Teach Me ADHD course and developed a detective theme. It's because I often tell kids when I meet them for the first time, I actually feel much more like a detective. I need to look for clues in what they're telling me and what they're showing me so that I can understand what's going on. Because oftentimes you can't just know by looking at them. And so screening tools are an important way for pediatricians while you see them in the office to get meaningful information, whether it be about your child's development or behavior, how they're thinking and feeling, like I said. But then it's just that. It's a snapshot in time. So a lot of times parents, when I give them a screening form, they often will want to ask questions like, well, I'm not sure about what this one meant, or, it was really hard for me to pick one answer because sometimes it's like this and sometimes it's like that. And my advice to you, if you get a screening form from someone, is to just know that it's a way for you to give information and to do your best because honestly, when that person who wanted that screening form filled out gets it, they're supposed to review it with you and use that as a springboard for conversation. So if there's anything that, again, you felt unsure of, you can absolutely bring that up to your doctor's attention and say, hey, this question, I wasn't really quite sure. And that tells your provider to go ahead and ask a little bit more and dig into that. And then, likewise, the pediatrician, when they're scoring it, if there's some responses to certain questions that will, kind of pique their interest and make them think, ooh, I better ask a little bit more about this. I need to focus more and use the time to really dig in on that aspect. So, really, a screening form is a screener, it's not a diagnosis, and it's a way for physicians and other professionals to use that information as the starting point in an ongoing discussion. Because, like I said, behavioral mental health issues, there is no quick way to really understand what's going on quickly. You've got to really spend time understanding the context, hear all the stories, the good stories, the not so good stories, just so that we can better understand why this behavior is happening or why this issue is happening. And so, again, screening tools just help us better understand how to quantify either the frequency or severity of a behavior. And then also it can also help give families a better idea of how their child compares to other kids their child's age. Certain screening forms, depending on what it is, can provide that useful information, not just for the provider but for the family, to put some context to it. So I hope you found this video helpful and informative. If you have any other further questions, remember this is not a substitute for medical advice. You can always post general questions here in response to the video, but always talk to your child's pediatrician or their primary care provider because they're the ones who know your child the best and they'll tailor your child's care appropriately. Well, I hope you found that helpful. If you have any other future questions or episodes that you'd like me to do, don't be shy. Let me know.